Picture yourself standing in an empty room, performing one of the most mundane actions imaginable, turning on a tap and watching a single drop of water fall into a glass. We instinctively assume that the water simply originates from the wall. We turn the handle, the water flows, and we continue our day, reinforcing a deeply ingrained belief that we are entirely independent and self-sufficient. That narrow worldview shatters the moment a collective crisis strikes. When a highly communicable disease breaks out, the routines we rely on freeze, and the illusion of self-reliance instantly dissolves. When that facade of isolation falls away, we have to ask a practical question. What is the actual hidden machinery operating behind the scenes to keep us alive? To map how we survive, we must pull back from that single isolated room and look at the sweeping, interconnected reality of an entire country. This is the domain of sociology. At its core, sociology is the science of understanding the interrelationship of our social actions, mapping the precise cause and effect of human behavior. Sociology serves as a vital diagnostic toolkit. It allows us to see exactly how one isolated action by a single individual triggers a massive ripple effect across an invisible societal web. Connecting two cell phones requires amplified waves, routing through local towers, pinging satellites, and traveling down wire. Applying this systemic logic to water, getting clean water requires a subterranean network drawing from natural bodies, routing through filtration tanks, and pumping through an equitable distribution grid. Physical infrastructure is easy to visualize, but we rely heavily on an equally complex human infrastructure. To see it, we can look at the most vulnerable unit of society, a newborn infant. For the first 6 months of life, a baby's entire universe is incredibly small. Their mother acts as their sole source of vital nutrition and immunity, providing everything required for survival during the lactation period. As the infant grows, their social radius rapidly expands. They connect with relatives, find friends for socialization, and integrate into educational institutions. Just as a reliable flow of water requires a sprawling network of physical pipes to reach a house, a human being requires a progressively expanding network of social relationships just to develop into a functioning adult. We can observe the ultimate test of our human infrastructure by looking at what it takes to deliver a single, safe, communicable disease vaccine to that growing child. The journey of a vaccine from a laboratory to a child's arm involves a chain of logistics that reaches deep into the local community. It starts with the visible frontline workers. This includes general nurses and auxiliary nurse midwives, or ANMs, grassroots-level health workers who serve as the first point of contact between the community and the broader health system. Behind those nurses is an unseen logistical layer: laboratory technicians running efficacy reports, administrators handling heavy documentation, and pharmacy workers sourcing medical materials. This node network chart shows the organizational tree required to administer a single vaccine dose. As it rapidly branches outward, we see the foundational public health layer: wardens, facility staff, and the sewage workers maintaining the baseline sanitation that makes healthcare possible. A single drop of vaccine is the culmination of an invisible army of social cooperation, illustrating how even our most private health moments are deeply embedded in a collective effort. When we map society out this way, we are left with a stark reality. Absolutely nothing in human life is truly free or isolated. Look at the food supply. Our daily survival depends entirely on farmers, who depend on carefully collected seeds, vegetative propagation, reliable access to water, and functioning global trade systems. However, society is deeply divided. People are living vastly different lives, separated across lines of religion, caste, gender, physical ability, health, and social status. To navigate this friction, we can look at the ultimate metaphor. Sociology is like the sun. The sun provides the light necessary to make physical objects visible to our eyes. Sociology illuminates our invisible social dependencies, removing the blockages created by bias, discrimination, and ignorance. This sunlight acts as a tool for NGO workers, social workers, and everyday citizens. It allows them to bypass deep social divides, initiate vital interventions, and serve vulnerable populations effectively. By understanding this architecture, we can build more equitable systems, delivering care without discrimination and creating a foundation for a more resilient and integrated society.